Brooks is the Vice President of Consumer Engagement and Partnerships at the Us Against Alzheimer's organization. She's going to discuss BrainGuide. It's a first of its kind web and phone-based platform that's been developed by Us Against Alzheimer's that empowers those living with cognitive impairment and their care partners with free knowledge and resources. Brooks, coming to you. Thanks for being flexible with us.
Great. Thank you so much, Phyllis. And I can honestly say that today is a career highlight. I've never believed I would be following Secretary Sebelius in a conversation. So thank you again for being with us today. I just want to pick up on one of the comments that she made around providers. You know, here at Us Against Alzheimer's, we really believe that we have to have an impact around prevention and early detection on the system side, and the policies need to be in place. But we also know that providers, and in particular, primary care providers, nurses, healthcare practitioners, really need to be well-informed about risk reduction, about brain health. We've recently launched a Brain Health Academy where every month we're educating upwards of 1,000 different healthcare practitioners about the risk reduction guidance that we have now created and based on the Lancet report. So we are completely in agreement that the provider community is a big, it's part of the three legs of the stool. And then the third is consumers. We know that if we can create consumer demand and we can invite people to feel empowered to start talking about their brains as a vital organ, that can help with the system change as well. And as many of you know, we launched about 4 years ago now the Be Brain Powerful campaign, which was a women's focused campaign designed to basically give women a tip every month about what they could do to have a healthy brain. And at the time, it was very innovative, and there was nothing else like it. It was based on research. We launched it in Switzerland as well, working with the Women's Brain Project. And it's been a really great testament to getting women the education they need. That has morphed into the development of a much broader program, as Phyllis mentioned, called BrainGuide. And BrainGuide was built using assessments that exist in the clinical setting today, working with medical experts, working with community leadership to essentially provide consumers the opportunity in a very private, safe, and free way to test their own memory using a memory questionnaire. It's based on validated tools that exist, as I said, in the clinical setting today. It exists in both English and Spanish. People can take a memory questionnaire for themselves, or they can take the version that's designed for caregivers of loved ones that they see often. And we launched back in March of 2021. And to date, we've had nearly 300,000 people take a memory questionnaire. And what's unique about BrainGuide is that it allows you to get custom resources based on the answers that you provide. So we have multiple algorithms and technology on the back end that allow folks to take the memory questionnaire, answer some of the questions in addition to the word test. And then we provide you with very tailored information based on your responses and how you do. And what's been remarkable to see is that, perhaps not surprising, about 78% of the people coming to BrainGuide are women. Most are between the ages of 60 and 85. About half are self-reporting being concerned about their memory. And of those, 78% score poorly, meaning they are not able to remember all 4 words in the word test. And so we direct them to very specific resources and empower them to talk to their doctor. We wanted to inform this dialogue with this resource because it's just one way that we're trying to spark the conversation and get more people into a discussion around early detection and also around prevention and risk reduction. So we would welcome anybody, give it a try. You can go to mybrainguide.org or call the 800 number on the screen, and we welcome your feedback. Today, it's available in English and Spanish, and we're hoping to add more languages soon as we bring this to the global stage. So thanks for the opportunity to share more with the group today, Phyllis.
Thank you.